my name is Mary O'Neill. My title is I'm the director of the Women's Neurology program here at the Brigham and Women's Hospital. The Women's Neurology program is a very broad-based program to look at many neurologic disorders that women can suffer from, and to look at that through a lens of what is the best treatments and evaluation for women with that problem. The Women's Neurology program is unique because it's one of two in the entire world. So there's not many other ones around. And it's, specifically to look at some of these gender differences and to target our treatment with the best medical knowledge that we have. And at Brigham and Women's Hospital, we happen to be blessed with specialists in almost every domain who have this gender-based lens up on their horizon. It actually is a very broad spectrum of disorders that we focus on. So I sort of see myself as the core, and we have these spokes, and within each of our subspecialties in neurology, believe it or not, there's multiple providers who have expertise in this area. So for example, multiple sclerosis, epilepsy, cognitive and behavioral disorders, headaches, migraines. Those are just within our department. And then we have a sister program with psychiatry and women's mental health. So we overlap a lot with those providers as well. Obstetrics, obstetrical anesthesia, neurosurgery. So we have is a very broad, both interdisciplinary and intradisciplinary program. Well, it turns out there's a number of disorders that affect women preferentially over men, such as migraine, which is 3 times more common in women. And then there's a lot of other disorders that affect men and women equally, but because they affect women through their reproductive years and through pregnancy, have very special considerations. And epilepsy is an example of that. So because women have different set of genetics that predispose them to certain kinds of disorders, such as autoimmune disorders, and because of pregnancy, there's a number of issues in almost every single one of our neurologic disorders that are specific to women and that are important to think about when you treat women. Almost any woman who has a neurologic disease is appropriate for the program, but there are some things that we really would like to see. So certainly women who are planning pregnancy or who are pregnant with a neurologic disorder would be very important for us to see. And then particularly women who have disorders that have significant gender concerns, such as epilepsy, because of the medicines we use, can have problems with bone health, for example. Migraine is another great example of a woman's disorder that there's a lot of concerns about how to use contraceptives appropriately for these women and how to treat them appropriately both before they're pregnant, during their pregnancy, and in the postpartum menopause years. Autoimmune disorders like lupus is another disorder that's 8 times more prominent in women. And women with neurologic manifestations of lupus really should be seen in some sort of program where it really understands those gender-based concerns. Yeah. My goal for each patient is to deliver high-quality gender-based care. So what does that mean? It means that for each condition, to find out, again, depending on what that woman wants and needs at that particular stage of life, to make sure that they are able to fulfill those goals, whatever they may be.